The next bone is fascia gigantica. The fascia gigantica is very look like the fascia hepatica, but there is very small difference between these two bones. In this slide, you can see the morphology comparison of fascia gigantica and fascia hepatica. The first thing is the size. You can see the fascia gigantica is more longer than fascia hepatica. The second item is that the cephalic cone, which is very better in fascia hepatica, but it is not clear in fascia gigantica. The third difference is depending on shoulder. You can see the shoulder in fascia hepatica, but we don't have shoulder in fascia gigantica. The next difference is at the posterior part of the bone. As you can see, the posterior part of fascia gigantica is look like U, but the posterior part of fascia hepatica is look like V. So, according to these difference, we can recognize them from each other. The other important thing which we can compare fascia gigantica as fascia hepatica as very look like to each other. The morph is the size, acetabulum. Of course, the acetabulum in fascia gigantica is bigger than fascia hepatica. Upper reproductive system and cephalic cone. Host is cattle, camel, buffalo, pig in Asia and Africa. And life cycle is similar to fascia hepatica, and the treatment is also similar to fascia hepatica. The next trematode which we are going to talk about is Dicrocelium dendriticum. It's also from the diagonal trematode, part of Dicrocelidae family, and of course the parasite of the liver. Commonly known as the lancet fluke because of its blade shape, small liver fluke. Size is very smaller than fascia hepatica. The length of Dicrocelium is about 6 to 10 millimeters, and the width is 1.5 to 2.5 millimeters. It is necessary to mention that at the posterior part of this bone is pointed ends, and it has 2 lobular testicles, but 1 lobular ovary. The ootype is under ovary, and the yolk glands is inside the body against each other. In this slide, you can see 2 pictures. The left one is adult form and the right picture is an egg. In the left picture, you can see internal organ of the bone. In anterior part, you can see the oral cycle and pharynx and esophagus, which divided into intestines. These intestines doesn't have any way to out and doesn't have any branch, so we call them the cecum. After that, you can see the testicles, 2 lobular testicles, and under the testicle, you can see the ovaries. In 2/3 part of posterior of the bone, you can see the branches of uterus, and of course, you can see 2 uterine glands in the right and left part inside of the bone. In the right picture, you can see the egg of Dicrocelium. If you have a good look at this egg, you can see that it has 2 layers and ovum inside, and asymmetric in length. In this picture, you can see some Dicrocelium which was collected from an infected adult, and after that washing, this is the natural form of the worm. In this picture, you can see the picture of uterus of the worm. There were a lot of eggs with two colors, dark brown and white brown. The eggs which are younger is light brown and the older is dark brown color. In this picture, we are looking at a very simple life cycle. You can see the final host, sheep or cattle, the intermediate host, which is a mollusca, and the second intermediate host, which is an ant. We will consider it in the next slide more. In this slide, we are going to consider the life cycle of the Dicrocelium better and clearly. As you can see, the eggs of the Dicrocelium sent out by feces after defecation, and the mollusca ingested the feces with eggs of the Dicrocelium inside the body. The miracidium will hatches from the egg, and it will be changed to mother sporocyst, and after that it changed to daughter sporocyst, and finally we have the cercaria, which go out by slime ball. The ant, the second intermediate host, will eat the slime ball, and after that the ant will be infected by the cercaria. The cercaria transfer to abdominal, chest, and brain of the ant, and they will be changed to metacercaria. And when the cow is ingesting plants, they will ingest the ant with metacercaria, and in the intestine of the cattle, the metacercaria will be changed to adult form, and the adult form will transfer to gallbladder and bile duct. As mentioned before, we told you that the Dicrocelium has two intermediate hosts. So, in this slide, we are going to introduce them to you. The first intermediate host of Dicrocelium dendriticum is land snail, like the genus of Helicella, Sionella, Zeberina, Apida, and Cochlicopa. The second intermediate host is Formica fusca. The final host of this worm is sheep and cattle, and human will be infected accidentally. In the next slide, we are going to consider the pathology of the Dicrocelium dendriticum on the host organs. At first, we have to attention to liver, because this worm is living in bile duct and in gallbladder. So we are going to consider that what happened. Usually, when there is not a lot of worm, we do not see any problem in bile duct. But sometimes, when the number of these worms are increases, we will see the bile duct obstruction. Some other times, we have the hyperplasia of bile duct, and after that, sometimes we can see the fibrosis and also the cirrhosis of liver in people who are infected to Dicrocelium dendriticum. In this slide, we are going to talk about the diagnosis of infection to Dicrocelium dendriticum. The best way is biological technique, and it depends on finding egg in the feces of the patients. It's better to prepare a wet mount of the feces and looking for the eggs in that. The treatment of Clostridium infection is depending on using praziquantel 25 mg for 1 kg 3 times a day for 2 days. The next worm is Clonorchis sinensis, or Chinese liver fluke. This worm is flattened without a spine. The color is dark ash and the size is about 3 to 5 millimeters wide and 12 to 20 millimeters length. The oral sucker is bigger than ventral sucker, and you can see the picture of this worm in the right side of this slide. As you can see, after oral sucker, we have the pharynx, esophagus, and the esophagus divided into intestine, but the intestine doesn't have any branch, and they are also second because they have no way to out. The other important thing is looking at the posterior part, and you can see two testicle or two branch testicle. In this picture, again we have Clonorchis sinensis plus its eggs. The egg size is about 16 to 29 micron, and it has opercle and a knob in the opposite of opercle. In the right side, you can see another picture from the Clonorchis sinensis, and you can see that the anterior part is more narrower than posterior part. In this slide, again we have Clonorchis, but it's a schematic picture of Clonorchis, which we can name any organelle on it by alphabet of English alphabet. The A is oral sucker, the B is esophagus, the C is intestine, D is uterus, E is yolk gland, F yolk gland duct, G vasa efferent, H testis, I pharynx, J brain, K ventral sucker, L seminal vesicle, M ovary, N seminal receptacle, O excretory bladder, P excretory pore. So we could introduce all part of the Clonorchis sinensis in this slide to you. We are going to talk about the life cycle of Clonorchis in this slide. If you can see, the human can be infected by eating raw meat of fish. So if we want to continue this cycle, we have to start from one. The embryonated egg pass in feces. These eggs will be ingested by the snail. In the snail, it will change to miracidia and change to sporocyst and again change to redia, and finally we have the cercaria. Cercaria also swimming in the water and insist the skin or flesh of freshwater fish. Metacercaria in flesh or skin of freshwater fish are ingested by human, host, or other carnivores which eat these infected fish. And what happens after that? The metacercaria will transfer in the body and exist in duodenum, and after that they can go to peritoneum and they will transfer to liver. And after grown up, making adult in biliary duct, and they will produce the eggs which can be out by the feces. Remind you that when we were talking about the decrocellular dendriticum, we thought that it has two intermediate hosts. Of course, we have to mention that Chlorokis sinensis have two intermediate hosts too. The first intermediate host of Chlorokis sinensis is operculated snail, like Alucina and Parafusarulus. After that, we have the second intermediate host for Chlorokis sinensis. The second intermediate host is freshwater fish. Of course, the family of Cyprinidae is the most fishes which are infected by Chlorokis sinensis cercaria. The final host of Chlorokis sinensis is cat, dog, and pig. Now it's better that we talk about the pathology of Chlorokis sinensis. As you know, the living place of Chlorokis is in bile duct of liver. So it will irritate the bile duct plus high WBC. Of course, it is interesting that we have normal SGOT and SGPT tests in people who are infected to Chlorokis sinensis. Besides that, we have high eosinophily, and in some cases we have the carcinoma of liver, and the other patient we have the fibrosis. The epidemiology of Chlorokis sinensis is clear for everybody because eating infected fish will transfer the worm or metacircular of worm to final host. No infection in the north of China is seen because they do not use the human feces for feeding the fishes. Infected people in the south of China feeding fish in pool with human feces. But how can we diagnose the infections of Chlorokis sinensis? It's clearly that most of infection has no sign, but in some of the infected people we have fever, some with icterus, and finding egg in the feces is the last and the best way for diagnosis of Chlorokis sinensis infection. In this slide, we are going to talk about the treatment and prevention of Chlorokis sinensis. The best way for prevention is cooking fish, drinking sanitary water, cooking vegetables, and no human feces for fish pool. Of course, treatment is using praziquantel 25 mg for 1 kg 3 times a day for 2 days. We are going to talk about two other liver flukes. The first one is Opisthorchis felinos. The Opisthorchis felinos is very similar to Chlorokis sinensis. In the left picture, you can see the picture of Opisthorchis felinos, and middle picture, you can see Chlorokis sinensis and Opisthorchis felinos. As you can see, they are very similar to each other, except the testicle. The testicle of Opisthorchis felinos is not branched, but in Chlorokis sinensis, the testicle are branched. The morphology of Opisthorchis felinos informs us that the size of worm is about 7 to 12 millimeter length and 1.5 to 3 millimeters wide. The egg size is about 30 12 micron with too narrow end and lobular testicles. In this slide, we are going to talk about how we can infect it to Episturcis filinos. Infection transfer by eating intermediate host. But what is the intermediate host? The intermediate host of Episturcis filinos is Bulimus amcyprinid the fish. The host or final host of this worm is cat, dog, fox in Europe, and Poland and Russia. Diagnosis, prevention, treatment is look like the chloroquine sinensis. In the next slide, we are going to talk about the Episturcis viverni, which is another liver fluke. Of course, it is very similar to Episturcis filinos, but the size is a little different. The worm size is about 20 to 60 millimeter, but the testicle is clover leaf-like. Episturcis viverni intermediate host are some species of snails and fishes. The host is cat, dog in Thailand. But something which is necessary to mention that a serious correlation with liver carcinoma was found out in Thailand and confirmed by investigation on the rate of infection in people. 1 in 100,000 and now 100 in 100,000 people are infected to carcinoma of people who are infected to Episturcis viverni. At the end of this part, I have to inform you that our reference for this material is Markel Vogt Medical Parasitology, and if there is any question, you can contact me in Department of Parasitology of Medical School of Shahid Beheshti. Thank you again for your attention.